Today I want to talk about what we call impingement syndrome. It's a pain in the shoulder. It's probably the most frequent visit I see on a daily basis in my practice. Commonly it starts in our fourth, fifth decade of life. And the patient's complaining of insidious onset, no history of trauma or anything, but they start saying my arm hurts when I raise it up, hurts me to sleep. If I reach back to my back pocket, women complain about fastening their bras, it's hard. And the pain is really caused by an overhang of a bone spur that creates the shoulder. As you look at this x-ray here, you can appreciate this is the shoulder joint, this is the humeral head, this is part of the shoulder blade. And I've made a little green line here. This is the top part of your bone when you were a young person, when you were 18, 20 years of age, with no pain, no discomfort. So you had this much clearance. As time goes on, we create an overhang, and you can see, if you look carefully, you can see an overshadow here of this bone down here. So that is your new roof. So in this gentleman right now, his clearance is pretty much about here. So he doesn't have a lot of space there to house that muscle. Now, that spur we talked about is this bone that overgrows and creates a little spike here. So you can imagine when you raise your arm up in that position, this is going to hit that tendon and it'll start beating it up little by little. And this takes years. I would say 8 out of 10 patients will come in with this pain and something as simple as a little cortisone shot. A cortisone shot that is fairly painless, comes from the back, in the back of the shoulder. I approach it with a small needle and we inject a little bit of cortisone. Cortisone is an anti-inflammatory. Cortisone is a steroid. If you take something like a Motrin or an Advil and Aleve, we call those non-steroidal anti-inflammatories, and that's because we have steroidal, which are more effective and stronger, and that would be in form of a shot. If we give you a shot and your pain improves, excellent, we leave it alone. If it doesn't get better, then that's when we suspect that you may have caused a little bit more damage on this tendon and possibly what we call a rotator cuff tear. So this is an MRI of a patient, and this is the same view. You can appreciate the humeral head here. And this structure right here is the rotator cuff. And you can see how abruptly it stops here, and there's all this fluid, all this white is inflammation. This tip of the rotator cuff should be right here. So if a patient like this, who's actually scheduled for surgery in a week from now, what we do is we go in, we put a couple of sutures through the tendon, and we tag it back to the bone here. As part of the procedure, we do shave that spur that caused the problem. All of this is done arthroscopically through small incisions. The recovery is kind of extensive. It's anywhere from 2 to 3 months of full recovery. You'll be using your arm and out of a sling within 3 to 4 weeks, but it'll be a good 3 to 4 months before you feel the benefits of an operation.